Our first community conversation, we're joined by Danielle Schrader, an oncology certified nurse with Sentara Martha Jefferson Hospital. She's sitting down with Aaron.
Hi Danielle, thanks for coming in today.
Thank you for having me.
You're very welcome. So February is National Cancer Prevention Month. So what are some of the key cancer prevention strategies that you recommend to patients?
So a lot of patients, there are some lifestyle modifications that individuals can do to decrease their risk of developing cancer. Those things are eating a healthy diet, so more vegetables, lean protein, whole grain foods, limiting alcohol, red meat, and those sugary beverages, so like your sodas.
Right.
You definitely want to maintain ideal weight. Being physically active, so even just mowing the lawn can be a moderate intensity exercise that would be good and a key strategy to help prevent cancer.
Okay, that is good to know. And how does the hospital support early detection and prevention efforts for cancer?
So I think we're very fortunate at Sentara Martha Jefferson. We have wonderful support from our team at our medical offices as well as in the hospital. We do a lot of community outreach, and I think that's key, getting education out there for prevention strategies, doing screening, holding screening events. We're fortunate to have a wonderful foundation that helps us be able to do those screening events, especially for patients who can't afford it.
Right. And speaking of screenings, what are the different types of cancer screenings available and who should consider getting them?
So you want to work closely with your primary care physician, but we do recommend women 40 and older, unless there's a family history, to begin getting screening mammographies. We do also have low-dose CT screening, so patients who have a history of smoking, they can get a lung screening usually starting around 50 years of age to about 77. We do colorectal screening, so that can be a colonoscopy, and if everything is clear, you don't need to do one again for 10 years. Or you can do an annual testing, which is the FIT testing. It's done in the comfort of a patient's home, and then they would send that in, but that would be done yearly.
Okay.
Yes.
Got it. And what's your advice for someone who wants to take proactive steps to reduce their cancer risk?
I think making those modifications to their lifestyle. So if you do smoke, try to work hard to quit smoking. I think also knowing your family history, that's key. Those are things that we cannot necessarily change, but you may be able to do screening earlier. And you know, having a primary care physician, somebody that you can talk to, let them know your history, let them know your risks, and then they will work with you to make sure you get appropriate screening and prevention strategies.
That is wonderful. Great information there for National Cancer Prevention Month. Thank you so much, Danielle, for coming in today.
All right, thank you.
You're very welcome. Amaya, over to you.